All right. Hello, everyone.
Good morning.
Good morning. I'm Kenneth, and
Good morning.
all right. Thank you, Gina. I would be presenting on prostate cancer. I don't know if I can proceed, or we still have more persons that would be joining the breakout session.
Okay, good morning.
Good morning.
I am Abdul from the Gambia.
Oh, okay. So thanks for joining. I even forgot to to introduce myself. I'm from Nigeria.
Okay. All right.
And so maybe others could as well.
Good morning. I'm Deborah Stamps from the United States.
All right. Welcome, Deborah.
I'm Oye Kola. I'm a consultant physician and clinical epidemiologist based in South Africa.
All right. Great. Okay.
Good morning. I'm Alice, lead research nurse in cancer, based in the UK.
All right. Welcome, Alice. So we can proceed now. I would quickly share my screen and then share a few slides with us. Okay. Can you see my screen?
Yes.
Yes.
All right. Thank you. So this presentation is building upon the ongoing conversation on generally on health inequities and discriminations affecting different groups. And in today's in this brief presentation, I'll be talking on prostate cancer, how we can break the culture of silence and curb disparities in prostate cancer, especially as it affects CALD and Black communities. CALD simply represents culturally and linguistically diverse groups. And my name is Kenneth, although I originally do not have a background in the field of health, but as a data analyst, my interest over the years has been revolving around health, both in analysis and in academic work, among others. So the inequalities that we have in also affects prostate cancer, just like many other cancers, and the statistics here show here. In 2022 alone, prostate cancer was the most common cancer among men, and in generally, Black men are more than 2 times more likely to die from prostate cancer than people of other races. And in the year 2022 alone, there were about 255,395 new cases of prostate cancer in the United States alone. And some of the patterns we've seen as it affects prostate cancer is the fact that in many countries, especially in developing countries, the data on some of these issues are hard to find, which is a pointer to the fact that there's a big gap in research in this field. You would find data on general cancer, but on how it affects different groups, especially prostate cancer, you would struggle with getting some data to back up a number of all these things. All right, so it shows that there's a big gap that needs to be opened, that need to be filled in this regard. So, what is this culture of silence all about? It's a tag for the tendency for people, most especially CALD and Black communities, to keep silence, like not being able to express themselves, express their pains at the onset of the symptoms of prostate cancer. prostate cancer is more of a men health, reproductive health issues, right? It affects men in general, right? But people of black community and CALD community, the men there, due to it could be attributed to things like a hyper masculinity that tends to encourage men to to as a show of strength, that when you are passing through certain pains, it's very unlikely of you as a man to speak up easily, to open up, and many individuals tend to bottle up some of these symptoms over the years and months until it becomes late, and then that is one of the explanations for the high mortality rate of people suffering prostate cancer, especially the black and the CALD group. So it's a societal issue that tends to place certain stigma or kind of judgment, or that sense of judgment and people, and this indirectly encourages men not to open up early enough, because generally for a disease that is highly curable as prostate cancer, if detected early, it is appalling to see that there's still a high rate of a high number of deaths attributed to this. So the cycle has always been that of concealing pains and symptoms to avoid appearing weak, weak in quotes, as they classify it, so that you don't tend to lose your status as a man and all. So when you are having these symptoms, instead of opening up and seeking medical help early enough, it could result to self-treatment or suppressing pain, and that's due to as a way to avoid some of these already mentioned factors like social stigma, judgment, shame, among others. And then among certain groups, it is also a known thing that there's this tendency to feel embarrassed or morally guilty to discuss intricate men's health issues, even with family members and health care givers, right? Because in certain cultures, it's not really, especially I come from Africa, and of course, it's usually an uncomfortable topic to talk about, and due to moral and societal norms, and all this result in delayed help seeking, and which generally decreases chances of survival. And the second factor we have to blame for this is our systemic and structural barriers. And that's the systemic failures. This has been already addressed and during the first presentation by Professor Gina. So it also translates, it's also something obtainable when it comes to fight against prostate cancer. There's a perceived and even actual existing mistrust between, among marginalized groups as it relates to standard healthcare systems, right? And this tends to make them to kind of shy away from them. And some other challenges you would also find with these institutions is that they have overly complex processes and procedures that could linger and prolong time to detection, diagnosis, and all that. If you come to low and middle income countries, mostly in Africa and other parts of the world, you see that to book should I say, a session with a healthcare specialist in some of our teaching hospitals and specialist hospitals, it could take up to 3 months, like a very long period of time to finally get to see a professional and an expert. And then given that in those countries we have a very disproportionate patient to doctor ratio, so that there are just few limited, very limited experts in this field that can tackle this, and accessing them is a big challenge. Then also is the issue of cultural incompetence, in the sense that the healthcare system sometimes tends to follow the standard structural and structured professional principles and etiquette that do not really consider the cultural nuances of the people, right? So there are a lot of myths that people the patients have built their lives around, and it is very important to understand these myths in engaging with them, because it is only through this way that we will be able to address some of these gaps. So let's look at different ways that we can address some of these gaps. the most important takeaway here is looking at addressing it from the perspective of grassroots and also system, that's at the healthcare system. The most important thing we should keep in mind as health professionals is that beyond the biology, beyond the formal etiquette of any of the profession, it is also important to acknowledge the big role that culture plays in people's lives, that culture directs people's way of living. It can even affect how much they share with you as the doctor. Sorry, I hope you can still hear me and see my screen. Hello?
Yes, it's perfectly.
Okay,
Yes.
all right. Thank you so much. So it is important to keep this in mind instead of dismissing some of these myths, some of these misconceptions that our patients already have in them, like not paying attention to some of these things. Then it is better to acknowledge that these exist and then find ways to engage them better so that we can extract the relevant information we need in diagnosing them early enough. Now, at grassroots level, we should try to foster that environment that where men can feel safe to share their health needs, health challenges without the fear of being judged and all. And this should start from the family level up to community and then society at large. We should empower men and let them know that it is not a show of strength to hide pain, that as a human, you can you can fall sick, you are not immune to diseases, and so it's not something out of this world to look out for help, right? And then as healthcare professionals, I've already highlighted the need to acknowledge this culture, recognize it, and then find a way to make these individuals feel safe enough to share their needs with you and to reduce processes that prolong the period of diagnosis and all, and also to combat implicit biases that we could have in us as healthcare professionals, right? So even if you are dealing with an uneducated individual, then you should find a way to still make them feel safe enough to share. And when language is a barrier, it is very important to also look at some of these nuances in setting up in our hospital systems, right? So our treatment guides and every other thing should be adapted to suit the cultural needs of the people. And then the last slide I have here is on the role of technology in addressing bridging this gap. And of course, we are lucky enough to live at a time when technology has made a lot of things easier in terms of communication and our day-to-day lives, right? Now, we've already highlighted the challenges of difficulties in accessing healthcare experts, issues with misconceptions, cultural misconceptions that tend to come in the way to intercept the right knowledge that the individuals, exposed ones, should have about their health system, about their health and all. So, Precision Digital Health is a digital health platform on a mission to bridge this gap because institutional reforms, family reforms, and all are some ways that we could bridge in. But of course, in elevating the impact, in helping to address these inequities in the health sector requires that all hands be on deck. So, as a technological solution to this problem, Precision Digital Health is on a mission to make the right tools and knowledge accessible to individuals who are at high risk of prostate cancer and then cancer in general, right? By offering them professionally vetted knowledge and information that they could use both at the preventative stage and supportive stage of cancer. Preventative stage is for those that are at risk but do not even know that they are at risk. For example, as a black man, I know that I am at a higher risk of developing prostate cancer than the someone from other group. But there are many of my colleagues who may not really know. They just go about their day-to-day businesses. They don't even know that they are exposed, and some do not even know why that the fact that having a family history of prostate cancer means that automatically you are exposed. So we try to raise this awareness because this is a highly treatable and curable illness, only that when detected late, it is fatal and terminal, right? So through a technology platform, we disseminate the right knowledge vetted by professionals. We make it possible for individuals to connect directly with health experts so that booking of appointments and seeking medical advices will be immediate and not something that will linger for months. And also to bridge the gap of data that we've already seen that it's a big issue in the industry. The platform is also on a mission to help to make data available for coming from these individuals, who are largely underrepresented. Building a community where people can share confidently and privately share their health challenges and get help, both as the individual suffering the illness and as a caregiver. And then collectively, we are building a world whereby our dads and our brothers can live a longer and healthier life. Because we all know that men usually have shorter lifespan, and sometimes it's because some of the needs. I think the urge to kind of to move along and not feel that vulnerable, as in you don't want to be seen as vulnerable and all that, make men tend to hide some of their challenges. And then in the end, you see that you are still a human, and when it becomes or already when it's almost already too late, that is when you see many of them already going to seek for medical help. So by bridging this gap, we are further removing disparities in the health sector and making our world a better place. So thank you for your time. And once again, my name is Kenneth. So I would stop the presentation, and then of course I will be glad to also attend to your questions if there's any. Thank you.
Thank you, Kenneth. That was really interesting and informative. One of the issues that we come across from a research perspective is that men do not like to participate in clinical trials, and particularly those of Black and ethnic minority. We have tried several approaches. However, when you look at the proportion of white men who go into clinical trials compared to Black men, it is a very, very, very wide gap, and that means we do not get data or results that represent those of Black and ethnic minority communities. Do you have any tips of what we could perhaps try and engage that group of men to engage with us when it comes to clinical trials?
Okay, thanks for that wonderful question, and it's even another perspective to look at. So in that regard, it's really an important gap to fill. But what I could say at this moment in terms of filling that gap could it be an issue with trust? I mean, trust with the healthcare system, and what are the institutions making to encourage, to get these people to feel safe that participating in these trials is for the overall betterment of themselves and society? Like, are there measures in place that encourages that trust? Addressing that issue of trust is an important thing to look at. So you could look in that line, right? Then I think everything I would talk about on this issue is all about awareness, right? And are they orientated? Being informed about the needs, and if some of them just have this issue of not seeing the bigger picture, being that okay, today we live in the world of AI and we're having issues with biases and all that, but usually it is because the data from this group, certain groups, are highly underrepresented. So it's important to help them to see that bigger picture, that you are doing this not only for yourself but also for the generation to come, right? So if there are measures to put in place to help them to gain that trust in the health sector and see the bigger picture of what is being what we are trying to achieve, I think it would help to bridge that gap. So those are the two suggestions I have, and I don't know if someone else has anything to chip in, and I can see.
Yeah, yes, I do.
Okay.
Alice,
Hello. Sorry, can anyone still hear me? I want to know if it's my audio. Oh, God.
how do we know?
Okay. Well, to answer that, I think the range of strategies are there because it's not. I mean, there's no one single strategy that has, I mean, that 100% guaranteed to work, right? So if the healthcare system issues are addressed and the grassroots miseducation or should I say issues are not addressed, the gap is still there, right? So in terms of knowing how which of them would work, it's should I say it is it's a question of it's a question of should I say we are not really looking at it as one approach. Like, we're not trying to address this as using one strategy alone, right? So these are all based on fundamental issues that we could even see by ourselves. With, I mean, as someone who has a lived experience of prostate cancer, I mean, my dad had prostate cancer, and then some of the things I shared are more of that experience, right? And then we eventually realized that based on what
So she needs
healthcare
to do the
professionals.
training logs fast before she does the delegation log.
Sorry.
I need to check.
Okay, so what I was sharing with you is mostly based on what the healthcare professionals are also saying, that people don't speak up, right? We discovered that many of the older men that were losing their lives was as a result of this illness, right? So it is a question of spreading our tentacles to address a broader to develop a broader solution. Then in the line, we're eventually going to see which ones are more effective, but we can't really say unless we start, right? Unless we invest more in this. So thank you for that question.
Makes sense. Makes sense.
I think someone's okay. Seems like someone's hand is up.
Yes, my hand is up.
Okay, all right.
Oyekola.
All right, Oyekola.
I've got a question for you, Kenneth.
All right.
You mentioned implicit bias, and my mind goes to implicit racial and ethnic bias in healthcare providers.
Yes.
Is there a way you can limit these in a research setting? How can you control these in a research setting? Is it possible to answer that question?
So can you come again? I did not get the last part of
Uh,
it.
yeah, when you were talking, you mentioned implicit bias,
Yes.
and my mind goes to implicit racial and ethnic bias in healthcare providers, and the need for cultural sensitivity or awareness among healthcare providers. So I just want you to relate how this can be controlled or prevented in a research setting.
Okay, thank you very much. I think to control that, we need to look at the foundational setup of our research settings. One, in a should I say a simple sentence to define bias is the tendency to favor certain aspect of a thing over the other, and in terms of research, it is usually in manifesting in form of underrepresentation in data, right? And when you look at the foundational structure of those institutions, some ways that could address it is by encouraging representation of different groups, right? By encouraging representation of different groups, we will see that the nuances of the data will be enriched further, right? So as a research organization, when you are hiring, you should also consider the need for diversity to diversify your organization. If you are looking for data, you should not only base if you are looking for data for your research, you should not only base it on, unless a particular group is the primary group of interest, you should find a way to nourish your data so that different groups can be effectively represented. And then in the end, the inferences that you'll be communicating as an offshoot of the research would be something that would be easily generalized, something that applies to a broader group, not just the minor or subset of the group, so that you'll be able to present a bigger picture of the research outcomes. So that is one or two of the ways that you could look at it. Then it also goes beyond that in terms of the foundational makeup of the institutions themselves. You should also look at the individuals. At the heart of the individual as a researcher, you should imbibe with this culture of that openness, willingness to go and to know more about different, that openness to not be narrowed down to only a particular group, to not be narrowed down to only certain individuals or certain groups of people, but to be broad enough to understand how the course of your study affects the diverse groups, right? So by doing this, we are bridging that gap we are bridging that gap. So I hope this addresses your question. Sorry, can you still hear me?
Yes, Kenneth, I think everyone has left the room.
Oh, okay.